Hey lovers, it's your girl Sissy, the happy child. Health is beauty and wealth. Today, let's celebrate the beauty, the health, the strength, the resilience of women on this International Women's Day. Today, I want to use the occasion to bring to your notice an information of a silent killer that has been killing our sisters all over the world. I think this awareness is not sufficient, so please take this seriously. I bring to you the awareness of cervical cancer. Cervical cancer is a malignant tumor of the lowermost part of the uterus, that is the womb. From my research, long-lasting infection with some types of human papillomavirus is the major causes of cervical cancer. HPV is a common virus that can be passed from one person to another during sex. Half of sexually active persons can have this virus at some point in their life. So you see, if you are sexually active, you are susceptible to this infection that can cause cervical cancer. Good news is that cervical cancer can be prevented by the following. Number one, getting a pap smear test. A pap smear test is a procedure in which a small brush is used to gently remove cells from the surface of the cervix or areas around it, and this is to be checked under the microscope for cervical cancer or cells that may lead to cervical cancer. A pap smear test helps detect other conditions such as inflammation and infection. Pap test helps doctors detect abnormalities and changes on the cells of your cervix and helps them take action before cervical cancer develops. Number two, follow up on an abnormal pap smear test report. That is, if there are abnormalities in your pap smear test results, you need to go to a hospital and see a doctor for advice on how to go about treatment. Number three, get vaccinated. This is an immunization against human papillomavirus. These vaccines will help fight against viruses that can pose a great risk of cervical cancer. You can find these vaccines in government hospitals and some private hospitals. Go and make inquiries about these vaccines and the hospitals that have them and get vaccinated. Number four, practice safe sex. This is very important. Having multiple sexual partners and having unprotected sex can put you at great risk of having cervical cancer. Number five, stop the use of unprescribed antibiotics. If you notice any changes in your vaginal area, like itching, discomfort, heavy discharge, or smelly discharge, that is an indication of an infection. You need to run straight to the hospital to get tested. That is, having a vaginal swab test, HVS, will ascertain the type of bacteria that caused that infection. And you should be given a proper prescription of antibiotics by a doctor to treat that said infection. Number six, practice good personal and vaginal hygiene. It means you should bathe well regularly as a woman. Keep your underwears clean by washing them and sun drying. Use gynecologically tested vaginal wash. I, for one, use Oriflame Feminine Wash to wash the vulva and other outer layers of the vagina. Do not douche. Douching is a process of cleaning out the inside of the vagina with water and other mixed fluids. This is not good at all because the vagina cleanses itself. And by douching, you can destroy the pH level of the vagina and introduce an infection. This is the picture of the result of my recently done cervical cancer screening test. Amazingly, this test is advised to be done only once in 36 months. That is once in 3 years. Funny enough, the screening is not expensive. I actually paid 7,000 naira to get this screening done. Though it varies from different hospitals and labs. Please do not take this message lightly. A lot of women are dying from this silent killer all over the world. I call it a silent killer because it has little or no symptoms. It means you can have it and not know until it has gotten to the worst stage. I actually lost an aunt of mine to this silent killer last year. May her soul rest in peace. So please do not wait for people to learn from your own experience. Go get a cervical cancer screening done. To all the women all over the world that have fought and is still fighting for their health and their rights and the health and rights of others, thank you. I love you all and happy International Women's Day.